Professionals treating traumatized people.
The first word, of course,
different targets, different waiting time targets, different performers, different tick boxes that we've got to do, and that's across the field of medicine.
Being a psychiatrist, which is very
It's maddening for patients, and it's maddening for
Shrink Radio.
I think there is something we could do, and I think it's something about making every interaction we have with a patient therapeutic. I think be that kind of seeing a patient as a one-off, maybe as a kind of an emergency or crisis assessment, or trying to explain someone's medication to them, or even doing a mental health act assessment. It's trying to make that interaction as therapeutic as possible. I think that's something that's lost in other medical professions. I spoke to medical students about the doctor-patient relationship and the therapeutic relationship and what those terms meant. And the medical students thought a therapeutic relationship was only something a patient could have with a therapist. So they had no concept that every healthcare professional needs to have a therapeutic relationship with their patient. So I think fundamentally there's something missing when we educate and train medical students and junior doctors. But I think as psychiatrists, we're really good, hopefully the majority of us, the psychiatrists I know are really good at having a therapeutic relationship with patients for however long the relationship may last, be it 5 minutes or be it 5 years. And I think that's something we need to promote and that we need to hold on to and develop in our kind of junior colleagues.
and be really proud of.
I mean, I suppose, I don't know whether the word therapeutic might be a bit awesome for some trainees or whatever, and I don't know whether see what I don't get there as a service user is, are you trained in it being a therapeutic relationship, and do you understand what you mean by the word therapeutic relationship, or are you saying really that it should be a human-to-human relationship? Because Khaldun was talking about the meaning of the doctor, and that is so powerful, the meaning of the doctor, whether it's in a GP setting or a psychiatry setting or any other setting. The doctor is the all-powerful expert on your condition. And this really, really loads the encounter in a psychiatric setting of your meeting with the psychiatrist. I know on many occasions I've thought to myself, what is going on in my head? Why is it like this? Blah, 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 blah. Oh, all I've got to do is see a doctor and they'll be able to tell me and they'll know and they'll understand. That is not what I discovered when I went to see the doctors. And over the course of 20 years, I may have had 8 separate diagnostic labels attached to what was actually a continuous, complex mental disorder. Part of the reason why the labels were becoming different was because the words that I would use to describe them over time changed.
Shrink Radio.